Hello and welcome to a new week on the Cancer Awareness Month here on the Super Morning Show on Joy 99.7 FM. My name is Kojo Akoto Boating. This week we are focusing on children. We are focusing on the future. And when children are children, they also suffer a lot of diseases. And they've not been spared by cancer. So this week we'll be talking about cancers that affect children and how we can all work to fight and prevent cancers that affect children. And our guest today is a pediatric oncology fellow at the Kolebu Teaching Hospital, and she's talking to us about retinoblastoma. Her name is Dr. Samira Yamyolia, and she joins us to have this conversation today on the Super Morning Show. Doc, welcome to the Super Morning Show.
Thank you very much, Kojo. It's a pleasure to be here.
Okay, so you're a pediatric oncology fellow. When we say somebody is a pediatric oncology fellow, for example, what do you do?
So first of all, to be a pediatric oncology fellow, you have to be a pediatrician first, and then you're doing a subspecialty in pediatric oncology. So I am in my final year of pediatric oncology fellowship training. That's
so
what
I know pediatricians because at least I have children, and I know a pediatrician is a doctor who attends to children, right?
Yes.
So if we add the oncology to it, then it's a doctor who attends to children's cancer issues. Am I right?
Exactly. So a pediatrician who takes care of children with cancer.
Now, today we are talking about retinoblastoma. When we started the series, and Professor Akapo was our first guest, and when he was giving us a general overview of cancers, one of them stuck out with me. He mentioned retinoblastoma as a cancer that affects children. As a father, I was like, why mustn't I be interested? Because I have children and I may have even more. So it's really great to have you to talk to us about retinoblastoma and what really is it for people who don't know what is it. In fact, I don't really know what it is in detail, but I know it's a cancer that affects the eyes of children. What is retinoblastoma and how common is it in Ghanaian children?
Thank you very much, Kojo. So retinoblastoma, like you said, it's a cancer of the eye in children. It's actually the commonest primary cancer that affects the eye in children. So the retina, so when you take the eyeball, I don't know, we can't show pictures here, but when you take the entire eyeball, the back of the eye where you actually have the nerve endings to the eye, that actually picks the pictures from the eye and then transfers it into the brain. That part is called the retina. So this cancer primarily affects the cells in that part of the eye, and it happens in children. Like I mentioned earlier, is the commonest cancer in the eye of children, and it's something we see usually before they turn 5 years. The peak age, the commonest age at presentation, is usually less than 2 years. For statistics in Ghana, I think we did our local data in Kolebu for the between 2018 and 2023, we had about 156 cases of retinoblastoma.
Wow.
I don't know. Yes. That's what we saw. That's a total number that we saw in Kolebu between 2018 and 2023.
Retinoblastoma is a cancer that affects children, the retina. So we all did integrated science. The retina is where the light rays will hit, and then the nerves will take you to the brain and interpret it for you to see the picture that you must see, right? So it affects children, it affects their retina. And you just mentioned that as young as 2-year-old children get affected, but it's usually between 2, 4, 5, 6 to 10 years old, right? But can it affect both eyes, and what causes it?
So retinoblastoma can affect both eyes. So for what causes it, usually, for most cancer in children, an identified cause is not really known. But for retinoblastoma, especially those that occur in both eyes, there's usually some what we call a germline mutation, and then there's a small percentage of that, up to between 5 to 10% of that can actually be hereditary. So so for example, if a child comes with retinoblastoma that's affecting both eyes, most likely it's because we call what we call a germline mutation. Germline mutation is a mutation. So for example, like when the baby is still in the formative years, in the formative months, and as an embryo, and then something goes wrong. Usually we don't know what causes it. It's just something that goes wrong in how the cells in the embryo are being developed, and then they end up with what we call a germline mutation. Now, this, like I said, about 5 to 10% of it, 5 to 10% of them are hereditary. Most of them would occur sporadically. Sporadically just means that it just happens. And then you end up with that kind of mutation. And that's a type that can affect both eyes. Wow. Then, yes. So the mutations that usually happen later, they are usually sporadic, and that usually affects one eye. So we'll usually see those that affect both eyes early. Sometimes even at birth, if you're able to do a proper examination at birth, sometimes it can actually even be present when the child is born. But those ones are found earlier than those that are usually sporadic, and then they are in one eye.
And since this is a cancer that affects children, it means that parents are key in detecting this and reporting to doctors like you. So what are the warning signs that parents should look for?
So first of all, the commonest one is what we call the white eye. Or in medical terms, we call it leukocoria. But what it is that you would find that the center of the child's eye, what we call the pupil, would appear white. And you can actually just simply test for this by using like a flashlight. You know, when light falls on your eye, the center, the pupil usually would appear red. When you take a picture, when the flash hits the eye, you'll notice that in the picture it will appear reddish. But when you have retinoblastoma, that redness is not there anymore, and then appears white. So it looks like the eyes of a cat. You know, cats, when light falls on the eye, appears white. So that's one of the earliest signs of retinoblastoma. You notice that there's no red eye reflex; it actually appears white. That's one. And then they also can have strabismus. Okay, what we call alukumi. Okay. So sometimes the child is born normally, yes. So those ones usually, that's when usually the earliest sign. The earliest sign is the leukocoria, the white eye. And then you can have strabismus. So it's eyes that were previously normal, and then you start to notice that the eyes appear to be deviating. Okay, they appear alukumi. When I say alukumi, I'm sure everybody can understand what I'm saying. So that is also one of the signs. Then you can have the eye being reddish, and then just swelling. And then at a point, sometimes you can even see the eye getting bigger and protruding out of the eye socket. Those are those are late signs. By the time it starts protruding, then you are worried about that it is progressing. So the earliest you pick it up, the better, and then the easier we are able to treat retinoblastoma.
So the white eye or the cat's eye reflex is one of the primary ways or one of the primary warning signs every parent should know about, right?
Yes.
And then alukumi, which is the cross eyes or the misaligned eyes, is also something we should be looking out for. And then you also mentioned eye redness and swelling, right? When the eyes grow and like they're protruding outside, like they want to pop out of the skull, right?
Yes.
That's what the swelling is. But does this cause any vision problems in the initial stages of children?
So it does. So initial stages, some of them still have vision. So it's when it comes to the treatment, that's one of the things that are considered, whether there's even vision. Usually in the early stages, there is still some vision in the eye, and then when it's found early, that vision can actually there are ways of preserving the vision if you find it early. But as the disease progresses, then the vision is lost in the eye.
Interesting. We are talking about retinoblastoma, and my guest is Dr. Samira Yamyolia. She is a pediatric oncology resident at the Kolebu Teaching Hospital, and she's taking us through retinoblastoma, a cancer that affects children, one of the common ones. She mentioned earlier that over 100 cases are recorded annually at their facility, but it is something that we can all learn about and be able to detect and get help for our children. So we are going through the conversation. So far we've learned about the warning signs to look out for as parents and adults. Now we are going to the importance of early detection. So Doc, if we detect this early, is this something we can cure? How quickly does it grow? And even does it spread outside the eye? So if we detect this early, what can we do about it?
Okay, thank you. So, for retinoblastoma, it has one of the best prognosis in the advanced world. I think cure rate is even between 80 to 90% in the advanced world. That's mainly because one of the things is that they're able to pick them up early before it advances. So yes, retinoblastoma is one of the very curable cancers in children.
How quickly does it grow? As we learn about the various cancers, we've learned about cancers growing from stage 1 to stage 4. For something like retinoblastoma, if it's not detected early, how quickly does it grow? And does it stay only within the eye or it spreads outside the eye to other organs?
So for its being aggressiveness, it's not a very aggressive tumor, but it does grow quickly over some months. Okay. And it actually spread. It can spread outside the eye, so you can have it spreading out of the retina into the cornea, which is usually the front part of the eyes, and then it can also spread into the area surrounding the eye, and then it can go into the optic nerve and even extend into the brain, and then the bone surrounding the head, like the scalp. When it gets to that stage, it usually carries a very poor prognosis. So, like I said earlier, early detection is always the best, and then it's usually curable. Retinoblastoma is curable in the early stages. So, in the early stages, the treatment that we give for retinoblastoma is usually chemotherapy, and then followed by surgery, and then we do some more chemotherapy afterwards.
So it follows the treatment of some of the other cancers. You do chemotherapy where you use drugs to manage it, surgery to remove the tumor, and more chemotherapy to enable the healing process to continue. So are these the only 3 treatment regimes for retinoblastoma?
Okay. So for retinoblastoma, in the early stages, there's actually some local therapy that can be done to save the eye. You know, I mentioned that in the early stages, when there is still vision, sometimes they are able to save the vision because the disease hasn't really advanced. They have some injections, chemotherapy that can be directly injected into the sites of the tumor in the eye, and then you can actually save that child's eye. However, when it has advanced in the eye, still within the eye, then the option is to surgically remove the eye, what we call enucleation, and then a prosthesis will be inserted into the socket, at least so that the face still appears symmetrical. There is also radiation therapy, which we do not use often. It has other radiation therapy has other complications, especially like with those ones that, you know, I mentioned that some of them we can have what we call germline mutations. Like when you have a germline mutation, you're worried about doing radiation therapy because there's a risk of getting secondary tumor. So most of the time, it's usually chemotherapy, then surgery, or the local therapy, which I talked about, that will usually save the eye, followed by more chemotherapy after surgery.
Interesting. One of my biggest shocks this month has been the fact that we have only 3 facilities in Ghana for radiotherapy, 2 in Accra and 1 in Kumasi.
Yes, it is a big challenge. It is a big challenge. Yeah.
Well, we hope that we get money to resource the other health facilities so that doctors like you, for example, if you end up in my hometown in Nkranza, for example, you need to have the right tools to be able to save the lives for the children there. So I just pray that the Ministry of Health, the government, And even private sector people would invest in these things so that we can have enough across the country to help save lives. But you've taken us to treatment, but how do you diagnose retinoblastoma? My first guess is the eye examination you told us about, looking out for the white eye or the cat eye. That is one of the main ways you diagnose retinoblastoma. But what other ways do doctors and medical teams diagnose retinoblastoma before it's treated?
Okay. So retinoblastoma diagnosis and treatment is usually multidisciplinary. It's not just a pediatric oncologist. We usually do it with the ophthalmologist. So once we have a child come in with a suspicion, so like you mentioned, mother would notice that there's a white patch in the eye and then come to the hospital. When they come, yes, we also observe that it is there. And then the next step is to do imaging. So usually do an MRI of the head, and then you want to know where the tumor is. So MRI will let us know where exactly the tumor is. Is it in both eyes? Because sometimes, you can see the white reflex in one eye, and then you don't notice that it's in the other one. But you do an MRI and actually find out that both eyes are even involved. And then the MRI will also tell us the extent of the disease, whether it has involved the optic nerve, whether it has entered into the brain, and whether it has extended outside the eye itself. Okay. Then the ophthalmologist will also do what we call an examination under anesthesia. So they'll let the child sleep, and then they'll properly look into the back of the eyes so that they can actually properly stage it to know how extensive the disease is. And that would help us in the staging of the disease. And then, in addition to that, because we know what retinoblastoma can also spread into the bone marrow. I mean, when you asked me about where it can go to, I didn't mention that. So we'll usually take a sample of the bone marrow also for assessment to see if there's extension into the bone marrow. Okay. Then, when we put all this together, then we can properly diagnose the disease and then also know the extent of the disease and then properly stage it to know what treatment we can give.
You mentioned earlier that retinoblastoma is curable when caught early or treatable when caught early. But those that are not caught early, what are the survival rates we are getting in the country? And one of the things that is on my mind is, can children live normal lives after treatment?
So, unfortunately, cancer is a disease that when not treated continues to spread. And for it to be advanced, and then usually when it's advanced and there's extensive metastasis as it's spread into the brain, we usually know that the prognosis will be poor even when you treat. So with such cases, usually would start some palliative chemotherapy. It's something that it's not a decision that one person makes. It's usually multidisciplinary because we have to look at the benefits. Chemotherapy has a lot of side effects and all that. If you're going to put a child through chemotherapy with all these side effects, when you know that you're not going to achieve cure, it's a lot of things to consider. So sometimes we would put on what we call palliative chemotherapy, which we know would not completely be cure the disease, but will sort of slow down the progression and then the child will have a better quality of life. So that's what we do with those that are advanced. And yes, we have a lot of survivors of retinoblastoma. I know we had some survivors of breast cancer. I think we should consider survivors of some childhood cancers also.
Yeah.
We say, it will let the public know that people do survive childhood cancers. We do have a lot of survivors of retinoblastoma. So a lot of them would have a prosthetic eye fixed in, and then they go back to school and they're able to integrate properly.
Now, where can parents take their children for evaluation if they suspect retinoblastoma?
So once you suspect retinoblastoma, you can go to an eye clinic that has a qualified ophthalmologist. You can go to any general hospital where there is a trained pediatrician. Okay, you would go through the general examinations, and then when the suspicion is confirmed, then the child will be referred to the appropriate higher centers, oncology centers in the country. pediatric oncology centers. So we have, I don't know if you've mentioned this earlier in any of your sections, but we have 3 major treatment centers in Ghana for pediatric cancers. That's Komfo Anokye, Greater Accra Regional Hospital, and then Korle Bu Teaching Hospital. Then, apart from these 3 major centers, there are about 4 other shared centers. So shared care centers there are centers that some of them have pediatric oncologists that have been trained, but then, those facilities cannot provide the entire treatment for the childhood cancer. So you usually co-manage with the major treatment centers. So the shared care centers are Tamale Teaching Hospital, then the Volta Regional Hospital. No, sorry, that's the whole teaching hospital rather. And then there's Cape Coast Teaching Hospital. Then there's Agogo. There's a hospital in Agogo, and then the Sechiman Holy Family Hospital. So these are shared care centers where you can get some of the treatments, but then usually we manage together with these centers.
Wow. For a country that says that children are the future, I don't think we have enough of these centers. And for the numbers you mentioned in Korle Bu, for example, with the conversations we've had this month with other doctors, I am concluding that a lot of these cancers actually don't get reported at all. A lot of the cases don't get reported because people don't go to our hospitals. So I think that those of us on the Super Morning Show and all stakeholders should advocate for more investment in our facilities so that at least every region can have a center that treats these things, so that children everywhere and parents everywhere will have the assurance that should they detect retinoblastoma in their kids, they'll have help in their geographical area and not have to travel all the way to some of these places you mentioned. Now, doctor, before we wrap up, what do you have to tell parents? I think we need to talk about the screening, the early detection, so that we all know what to do to ensure children don't go through all the stages to get to a place where it's too late.
So, thank you, Kojo. You said something that I'm very happy about knowing that a lot of them are not reported. So even for our statistics right now, we think that just about 1/3 of our childhood cancers in general, not just retinoblastoma, childhood cancers in general, only about 1/3 of them are actually being reported. Because when you estimate according to our population, we should be getting about 3 times the numbers that we are getting. But unfortunately, they are not being reported. Part of it is that I think everybody knows about cancers in adults, but when you mention cancer in children, it's as if it's something that's so far away. Nobody thinks that it's possible. A lot of people don't even think that it's possible. So usually the first thing is in most of our communities, the first thing they think about is that somebody is doing something to the child, or there's some evil spirit or something. So it's one of them. It's a very big issue that people do not even report it. So I'm happy that you are actually bringing it up over here. So for parents, once you find something that is not normal in your child, I'll just quickly go through the warning signs of childhood cancers in general, because I can't speak about just retinoblastoma alone without talking about the other childhood cancers. So most of the time, once you notice something that is off about your child that has changed, for example, this retinoblastoma we are talking about, a child that was previously seeing properly, and then you notice that the child's eyes start to deviate and all that, then you should know that there is a problem and do not hesitate to seek help. So, for childhood cancers in general, we have an acronym. So I'm just going to go through the various signs in childhood cancers. So the acronym is SILUAN, SILUAN. So S means seek. So you seek help for anything that you don't understand, any unexplained thing that you see in your child that you do not understand, you seek help. Okay. Then the I is for the eye signs, so especially retinoblastoma, which we just talked about. So the eye, you notice a white spot in the eye. You notice that the eye is growing big, the eye is getting swollen, or the child starts telling you that they cannot see, or you notice that your child keeps bumping into things when he's walking, which are signs that the child may have some visual impairment, then you seek help. L is for lumps. So lumps mean any swelling in any part of the body. So a lump in the neck, a lump in the stomach. One of the other common childhood cancers is wounds. Unfortunately, we won't be talking about it. So sometimes parents will just be bathing the child and then they'll feel some swelling in the baby's stomach. It's one of all those things are signs of childhood cancer. So lumps in any parts of the body. U for unexplained. So unexplained weight loss, unexplained fevers. A child has had fever for about 2 weeks continuously. You keep going to the hospital or you keep going to a clinic, they say malaria. You go to a pharmacy, they keep giving you malaria treatment. I mean, a child can't have malaria continuously for 2 weeks and then you treat twice, give 2 full doses of malaria treatment, and then child is still febrile. So something like this is a sign that you should seek help because child should not have persistent fever like that. A child that is losing weight unexplained. So a child is eating well, doesn't have any other issues, but you notice that this child is just losing weight and it's not explained. Nothing else can explain it. And then also unexplained urine passing blood in the bloody urine, which you do not know what is causing it. All these things are things that you should seek help for.
Interesting. Learning new things every day here on the Cancer Awareness Month. Dr. Samira Yamyolia, thank you so much for joining us today to talk about retinoblastoma. We hope to get you back tomorrow to talk about one of the cancers that a lot of people are not paying attention to, but it's also affecting a lot of children, leukemia. Once again, thank you, Doc, for joining us today.
Thank you, Kojo.
My name is Kojo Akoto-Boateng. This has been the Cancer Awareness Month, and my guest has been Dr. Samira Yamyolia. Keep listening to the Super Morning Show. We bring you more tomorrow. Stay with us.